So when a medical professional is attempting to diagnose a migraine, it can be really easy if there's a family history of migraines or chronic headaches. And the diagnosis is a combination of that history of the symptoms that are being identified, since some of these symptoms could definitely resemble other issues. So they're very similar to different types of seizures. Some of these symptoms might actually look like a stroke, so it's treated very carefully, along with a physical exam, looking at reflexes, looking at brain, at eye activity, things like that. However, if there is no family history and some of these symptoms do resemble other issues, in order to rule out some of those other issues, medical tests can be or may be conducted. So blood tests look at different levels in the blood, MRI, CT scans, or a spinal tap or lumbar puncture. So kind of getting the sample of the fluid to see what's going on or out of the spine to see what's going on in the brain. There are quite a few different things that can be done to treat migraines. One of the first things that medical professionals often jump to, and we'll talk about other more therapeutic or more holistic therapeutic approaches. But one of the things that is used to treat migraines most frequently are medications to either stop symptoms or prevent future attacks. So the pain relieving medications are typically used to go ahead and stop those symptoms as they happen or as they're occurring, and then the preventative medications are used and taken on a regular, often daily basis to reduce the intensity of the pain and the frequency of the migraines. So those are used pretty often or regularly in treatment plans for people with migraines. And we'll talk about other things that can be done as well. In order to treat a client, it's based on how often they're having the migraines, how severe the headaches are, and to what capacity client is disabled. So are they able to work, go to school, interact, with their different family members, friends, and then other medical conditions and symptoms that might be occurring as well. Something to note, since medication is sometimes, again, the most frequent response and part of treatment, it's important to note that most medications are not recommended if someone is pregnant or breastfeeding. There have been about 2 medications that I've been made aware of that someone can use if they are pregnant. So that just shows a lot about how someone's impacted and if medication is that frequent response to take as part of the treatment plan. And then a lot of the medications are not given to children either. So again, just things to note. The goals of treatment and preventative therapy are to reduce the frequency and how often those symptoms occur, reduce the severity, so maybe minimizing some of those symptoms or getting rid of some of the symptoms, and how long the attacks occur. So medication can cut that 6 to 7 day time into a lot shorter of a time frame if migraines occur at all after being on medication, and other treatment and implementing other treatment options. Improving response to treatment, so picking or choosing types of treatment that the body will respond to. Unfortunately, bodies get very used to different medications and will stop responding if medication is what is being used as part of the treatment. In the past 3 years, I've actually been on, I want to say, 5 different medications so far because my body stops responding after a while. The goal is also to reduce level of disability, allow people to be able to go to work, go to school, function normally with their peers and loved ones, and then also to maintain costs for treatment. Something that sounds as simple as headaches can actually be very costly when you're going into routine checkups every 3 to 6 months and having to take different scans of your brain and pay for medications and other extra pieces of therapy if that becomes necessary. And then one of the goals is to also minimize the overuse of medications. Again, medication often is a first response because that's one way that doctors feel, will kind of train the brain against those symptoms. But there are other ways too. So in a treatment plan, kind of minimizing the use of medications could be helpful. Okay, so I'm not gonna review everything in super detail, time is limited, but um, there are several different medications that can be used, and there's a difference between, again, the pain relievers. There's your over-the-counter pain relievers like aspirin, ibuprofen, and specific migraine, like Excedrin migraine, marketed medications that people can use. How often taking those kinds of things too long or too often can create other issues, and it is only good once you already have those migraine symptoms. Triptans are one of the more common types of medications that are used, and they kind of block those pain pathways in the brain, um, and they're available in different forms. However, and there's all kinds of other medications that can be used. A lot of these medications come with other symptoms, and some of those symptoms often resemble, the same kind of symptoms you'd already be experiencing. So by taking some of these medications, you might have nausea, you might have dizziness, you might be very tired, which doesn't sound very different, I guess, than a migraine itself, but it is going to minimize some of those more severe symptoms, I guess. In addition to the medication that's specifically for the migraine symptoms, someone might be prescribed anti-nausea medication, specifically to address the nausea that could occur. And other things, as a part of a preventive medical therapy, is anti-seizure drugs, that can help alongside with migraine medication. Again, might cause different side effects like nausea, dizziness, and things like hair loss or weight changes like weight loss or weight gain. And this is people who've experienced 4 or more attacks per month, and their symptoms last more than 12 hours. This is when we start looking at those more preventative medical therapies like the anti-seizure drugs. Botox is also something that's supposed to be helpful for migraines, and somebody would have to get approved for that, and again show a history of a certain amount of migraine attacks per month in order to get approved for Botox. And working with my neurologist, that would be a last option, definitely a last option, not a first option. And so these are all the different kinds of preventative medical procedures or treatments that could be used. Again, most of them are including some sort of medication. Okay. Other treatments that can be used are things like acupuncture. Um, getting acupuncture can reduce that head pain. Biofeedback, so different relaxation techniques in different parts of the body to monitor physical responses like the muscle tension that can relieve some of the stress that might be contributing to migraines. Massage therapy helps relax the body again and helps to reduce frequency of migraines. Cognitive behavioral therapy, which are techniques that counselors and therapists can help with to teach clients or patients how to perceive pain, and also to increase different wellness activities. We're going to talk about some of the things that can trigger migraines, having to do with eating right, not eating right, not getting enough sleep, overexertion, stress. So promoting and implementing and teaching wellness activities, relaxation strategies, stress management techniques, figuring out what those headache triggers are so that you can modify your lifestyles and your thoughts to minimize the triggers so that the symptoms are minimized. These are all things that can be a part of cognitive behavior therapy. And then there's different herbs and vitamins that can be taken to help as well. But those studies have shown that the findings about those specific herbs are a little bit mixed. And again, and that's up to the particular person who decides that they want to go that route. But maintaining and being up to date with other vitamins can be helpful in the overall health and reducing those symptoms. Lifestyle changes and building certain coping skills are some of the best ways to ensure that a body is not stressed and that some of those triggers are reduced and minimized. And so practicing specific muscle relaxation exercises, helping a client, schedule themselves so they're getting the right amount of sleep, not sleeping too much, but not getting too little sleep. Finding time to just rest and relax, especially when there's already a migraine attack occurring, resting in the dark in a quiet room, placing a cool ice pack on your neck, things like that can really help. Keeping a headache diary is something that can be really helpful, and if we're a counselor or therapist working with somebody, that could be the kind of diary that can be recording symptoms and headaches, tracking triggers, and if and the effective treatments to those migraines when they happen. So recording all those things can help us find patterns and help clients determine what the specific triggers are, what worked when they had this type of migraine, what were the symptoms that occurred, and how long. So that could really help us help the client. And then really identifying what those triggers are and reducing them. So as I mentioned, I'll go a little more detail. Some of these triggers include a lack of sleep, a poor diet, so not eating right or not eating at all. Dehydration is a big one. So being overheated and not drinking enough water, enough fluids, feeling overly tired and overly stressed. So those are the main triggers. And so it sounds kind of easy, but it could be really hard to manage all of those things if someone's really stressed out or they're in the heat and they haven't had enough sleep or haven't had enough water. That can trigger a migraine. Okay, so if we're thinking about all of the different types of symptoms that someone could experience and all the different things that someone might have to do in order to treat those migraines or reduce those migraines, there's all kinds of effects that chronic migraines can have for a person's life. That's missing life events, social activities, days of work or school. It might impact performance at school or at work, not being able to do daily duties or things up to the expectation that someone else might have. Avoiding making plans because you anticipate possibly having a migraine or you already don't feel well and you think that that could be due to some of your migraine symptoms. So sometimes just not making plans at all, just to make sure you're not inconveniencing anybody. It could lead to negative relationships with family and friends. Can cause a lot of stressors when families and friends have to take care of someone who is always having a headache or nauseous or in pain and not knowing how to help them. Migraines have been known, or these kind of stressors have been known to lead to separation or divorce, and it's really hard to deal with somebody who's always having to rest in the dark, having to manage their migraine symptoms. There can be a financial burden for the cost of medical care, and that can go with any chronic issue, but these follow-up tests, changes in medication, things like that. And then it leads to needing to change your lifestyle, changing your routine to make sure you get enough sleep, changing your diet, not oversleeping, and then having to get used to medication every day if that's something that's part of the treatment plan.